Low back's been feeling good at work?
Yes.
Yeah.
Much better.
Alright, go ahead and take a big breath in for me. Breathe out. Okay. Other. And get to this side here. Nice. Hey guys, Dr. Will here from Miami Spine and Performance in Hollywood, Florida. We're here with another wonderful patient. We're here with Jessie. Now Jessie's really unique because she actually works with horses for a living. So she deals with these large, majestic animals, but they can be a lot to deal with, especially working on a ranch and things like that. So we've been working with Jessie on her lower back pain. She's feeling really good now, so now she's just coming in for kind of maintenance and making sure that she's healthy and she can do her job well. So we're going to take you guys through a typical adjustment. So as always, I'm going to start here and just check out the spine. How you been feeling, Jessie?
Good, real good.
So always a little bit here in the tailbone to work on, and then everybody could use a little bit of mid-back. We'll check up in the neck here if you could just drop your head to the right. Good. Drop to the left. Any headaches or anything lately?
A little pressure.
A little pressure, okay. Okay, so we know what we're getting into, so I'm going to have you go ahead and line your back for me. I'm going to start with the mid-back here. Do the old chiropractic hug, everyone's favorite. Right in that mid-back. Nice. One more. Okay. Roll on your right side for me. Low back's been feeling good at work?
Yes.
Yeah.
Much better.
We're going to do the SI joint on this side. So I'm going to have you give yourself a little hug here. You know the drill at this point. Alright, go ahead and take a big breath in for me. Breathe out. Okay. Other side. And usually on this side we're doing the lumbar spine. So we'll go right there. Big breath in. Breathe out. Perfect. On your back, please. So we'll see how the neck's feeling over here. Okay with the adjustments?
Yeah.
Good?
Real good.
It's Friday. Perfect day for an adjustment, right?
Exactly.
Work.
Loosen up for the weekend.
Mm-hmm. Alright, slide back towards me. So usually with the neck we can find these little areas that are a little bit tender. Do you feel that in there a little bit?
Mm-hmm.
Yeah. That's where a lot of these headaches and things like that come from, is these joint misalignments. And get to this side here. Nice. Jessie's always nice and relaxed, so ideal patient to adjust. She comes in and is relaxed. Okay. Same thing here. Just follow the hand.